Yes, thank you very much. I've listened to all of this with great interest, and everyone's comments reflect my own experience to a great degree. I've been a psychiatrist now for 37 years, and over the period of time that I've been practicing, there have been two medications that I think have revolutionized the practice of psychiatry. One was Prozac, about 1985, and all of its subsequent cousins have made a huge difference for people. The second one, in my opinion, has been Abilify. It has been an absolute miracle medication in my experience, working with a broad population. I was in private practice for 25 years, closed it when I got to be 60 and decided that if I was going to hike the Appalachian Trail, I better do it. And when I came back from hiking, there was a job open over at Dorothea Dix that I thought I would do for 60 days and ended up being there 28 months. I was the attending for the long-term female unit, and we had patients who were thought would never leave Dorothea Dix or one facility or another. One woman who was on 2-to-1 arm's length observation 24/7 was thought to have HIV dementia. On closer examination and on instituting a little different approach to talking with her, we discovered that if we stopped the lisinopril, she'd stop falling down. So that got rid of one of the 2-to-1. Then the second person was able to be eliminated in terms of observation by getting her started on clozapine. And her sister thought, well, this is absolutely wonderful. She's on clozapine, never seen her so well in 20 years. But she wasn't well enough to leave the hospital. And I found research that indicated that in some refractory schizophrenic patients, the addition of Abilify, because it is, Dr. Rich, because it is different in the way it works, it can have an additive effect to clozapine, which is also a miraculous medicine, really. But it didn't take away all the negative symptoms of schizophrenia. And by adding 30 milligrams of Abilify to her, they went away. This woman was discharged from Dorothea Dix Hospital within 3 months of my arrival there, and she continued to live a very nice life for the next 3 years until she died of cancer. And her sister called me last spring to tell me that she had died and to thank me for those 3 years of good life that she would not have had without finding that kind of an approach to her illness. Well, you know, I've got a patient right now in Greensboro. I see a few private patients. Mostly I'm retired, but I work 2 days a week over for an ACT team in Greensboro. Excuse me? Thank you. Well, I'll try to make it quickly. At any rate, this patient believes that he's being blocked in all the time by trucks and cars and one thing or another. It's a fixed delusion. The one thing I haven't heard spoken about with regard to Abilify is that in my experience, it is absolutely the only antipsychotic that will affect positively fixed delusions. And so therefore, if you have somebody with a fixed delusional disorder, I think that Abilify is the treatment of choice because it works and nothing else does. And I've seen that over and over and over again for hundreds of patients. The other thing is, if you want to take something off, not that I'm really advocating that, but I would take off all the Zyprexa or olanzapine drugs because they are the most likely to cause a metabolic syndrome. And I don't prescribe them myself because of that. It's really rare. I might once in a while if they really needed to gain weight. And then the other is clozapine. Having that taken off the preferred list, I think, is a mistake because for the patients who need it, it's absolutely life-saving, just like the Abilify. So thank you very much for your attention.